You want people to be part of something. And as I tell patients when they go through this process, when they trust us with their face, I said, you and I are in this together, because if you're not happy, then I'm not happy. I'm Dr. Mark Murphy. I'm a double board certified facial plastic surgeon in Palm Beach County, Florida. I've been practicing this region for over 20 plus years. I've been in this specific office for over 17 years. I've co-edited 6 textbooks on facial rejuvenation surgery, and my entire career has been dedicated to facial plastic and reconstructive surgery. My fellowship training and my background, Cornell, Columbia, that's very nice. But the real reason why you should come here is because how passionate I am about my work. In medical school, when I decided that I wanted to be a facial plastic surgeon only, because I always thought the face was the most elegant part of the body, and I thought I wanted to specialize in just one specific thing, because that's who I am. I only do one of these a day. I take a tremendous amount of pride in each operation we do. And at this point of the career, this practice has become what I've always dreamed it to be, solely based on facial plastic surgery and getting the results that we love. The reason why being a head and neck surgeon is so vital is because the results that we can deliver with our advanced anatomy knowledge of the head and neck is far beyond that of other specialties. And not only that, but to get the contours and the shapes that patients so desire nowadays, as you see a lot on social media and the things that are very popular now. A lot of those results are solely due to head and neck surgery anatomy, which if you don't have that, it gets very, very challenging. It's not impossible, but it's very, very challenging to get those types of results without that type of background. To me, the two are intimately intertwined. Without the technical expertise, you could be as charming as you wish, but you're not going to get people what they want. And on the other side of the coin, you could be technically superior, but if your office is run in a very haphazard fashion, if you're running people in, running people out because you're just trying to do as much as you possibly can in the workday, then you're not really delivering what you're supposed to be delivering, which is, we love it when people love coming. They look forward to us, they're friends with the staff. It's a really wonderful environment to be in. So I think the technical aspect and the compassionate one have to be intertwined, because if they're not, then what are you doing? This is what we are solely dedicated to doing. This is obviously my career, but this is more of a passion for me than a career. I love doing this. We do one of these a day. I take my time with it. The results I would put on parallel with pretty much anything else you would see out nationally, internationally, and I've trained with a lot of folks out there who do that type of work, and I've been very honored to learn some things from them, and I execute that, in my opinion and my patient's opinion, pretty well. I'm very blessed. My staff is fantastic. You could look on Google and all the reviews and whatnot. A lot of comments are not just about me, but it's also about my staff. And interestingly enough, at this phase of my career, I want to create a place where people want to come to work and get to express themselves and pursue their careers. That relationship I have with the staff is an extension of what we want to offer to our patients. You become part of this because you're trusting us with your face. And so I want patients to feel like my employees do when they come here, like this is not, a place I work or this place I get my surgery. This is a place I want to be. And that's what I try to engender here.